Thanks for taking the time to watch the Recharge Your Life series. I'm your host, Phaedra Antioco, and right now we are talking with Dr. Tom O'Brien, one of my favorites, about the hidden trauma of disease. Now, Dr. Tom is the Sherlock Holmes who really helps people uncover what's causing your chronic disease and teaches that recognizing and addressing the underlying mechanisms that activate an immune response is the map to the highway towards better health. So join me now as we talk with Dr. Tom O'Brien about how to fix your brain, how to really heal from the inside out. I'm so happy to have you here today, Dr. Tom, with your brilliance and your expertise. You are very influential in my own healing journey as I recovered from the trauma of a major car accident. So thanks for being here.
Oh, thank you. Thank you. It's always a pleasure to be with you. It's always fun.
Yes, we always go deep.
Yes, we do deep dives, and it's fun to dive with you.
Oh, thank you. So we're talking about those hidden traumas of all those life events, those stressors that happen, disease, divorce, being in financial overwhelm and debt, having a disappointment, something that didn't work out in your life. So I know you're huge into healing and fixing the brain. And as a chiropractor and a doctor, have you experienced working with people with these traumas that seem to linger, that they can't seem to shake them?
Oh, frequently. The first indicator that, let me back up there. I look at health as a pyramid to evaluate where is your problem coming from. And people think there's three sides to a pyramid. No, there's four. There's the platform or the base, and then there are three sides standing up. So the base is structure, and one side's biochemistry, what we eat and drink and breathe. One side is the emotional or spiritual, and the other side is the electromagnetic. And all four sides may contribute and often do contribute to different degrees to whatever problem you're having. So we grew up in a world thinking it's all biochemical. So you have a pain, take a pill because the pill is going to get rid of the pain, right? And sometimes that helps, certainly does, certainly. Sometimes it can be structural. And we've seen hundreds and hundreds of cases of that over the last 35 years, where working with the structure, with the spine and the muscles and the bones and the ligaments makes a difference. And we're seeing more now about the electromagnetic pollution. And when people take smart boxes off of their house and go back to the old way, all of a sudden their heart arrhythmias or their chest pains go away.
Wow.
Things like that happen all the time. So, but the fourth side is the mind, the spiritual, the emotional side. And it seems like that's one that you are really interested in here and you want to talk about. I just want to do the preface, though, that all four sides are important.
Absolutely.
So if you're eating ding-dongs and ho-hos and drinking Coca-Cola, you can't expect to be pain-free, right? Because you're polluting the biochemistry. So how you take care of your body, this sacred vessel that we have, is really important. And how you feed it is really important. But when you're doing that to the best that you can, and you may need to learn some new stuff, but to the best that you can, and it's not working completely, then one of or more of the other three sides of the pyramid need to be addressed. Not just the pain medication, not just the paleo diet, not just the foods and things. That we have to look at the other sides. And it's so very common, when I sit down and talk with somebody and they have been working on the other sides of the pyramid and really putting honest effort forward, but they're not getting the results they want, then, if you say something, just kind of look them in the eye with an open heart and say, so what's missing here? And they kind of go blank for a moment. And then many times, I'll say, what are you not saying? And all of a sudden, they start to swell up. Their eyes get moist. I say, that one, what's that thought? And then they start to discharge.
Yep.
Right? If you create a safe place and just allow that discussion to begin, floodgates often open up.
Yeah.
If that's the missing link in the pyramid of health that's causing or primarily contributing to the problem they're having. If that's the missing link, and if they've come to see you, or if they're watching this summit, this series, that you're doing, if they're in, then they want to open up. They want to find out what's the missing link that I'm not yet aware of that would help me with my pain, right? And I learned that very early in practice. I opened my practice on Valentine's Day, 1980. And it was very shortly after I read a couple of articles on this and started to look into it. There was this very famous surgeon in London who was knighted by the Queen. He was that famous, a surgeon. His name was Edward Bach, and then he became known as Sir Edward Bach. And a friend of his had gallbladder problems, and Sir Edward said, well, we need to do surgery. And the guy said, I don't want to do surgery. I mean, you're a good guy, but I'm not letting you put a knife to me. And, they kind of laughed a little or whatever happened with that. But Dr. Bach didn't see him. Next time he saw him, the guy was fine. He had no more symptoms. He said, so who did your surgery? He said, I didn't do the surgery. And he just looked and said, but it was obvious. You had severe gallbladder problems. We had to take the gallbladder out. What did you do? And the guy said, I smelled some flowers. And he said, what? And he said, a friend told him that there was this person that worked with flowers and with oils from flowers. And that for gallbladders, if you just smelled this flower a lot, it seemed to make a difference. And that just sounds so woo-woo to me. But Bach, because this was a good friend of his, looked into it, and he found there was such validity to it that he developed what became known as the Bach flower remedies.
Oh,
and they're world famous now.
Love them. Yes, they are.
Yes,
They're wonderful.
Yes, even you said, oh, wow, I didn't know that was the story.
Because if you're hurting and you go to the aisle in the health food store with the remedies, and there literally is a chart and a remedy for any feeling that you're having, like I'm stuck in life and can't find my purpose, you could take that remedy, and I don't know how it works, but if you can just intentionally put it in, it's placebo, I don't care, it helps.
Yes. And what Bach discovered, that this, because he looked at this flower and found the person and researched this and found that oil seemed to work for his gallbladder patients. And what he noticed is that gallbladder patients often are bitter about life. They're bitter. Heart patients have heartbreak. Colon patients have a shitty attitude to life. Excuse me, but
I love this. Yeah, keep going. What else?
He noticed it again and again and again, and he devoted the rest of his life to the development of these concepts. And if you read about the Bach, and that's B-A-C-H, if you read about the Bach flower remedies, it just kind of tilts your head. You say, well, certainly can't hurt anything, and you give it a try. So as you said, if you go to the local health food store and the charts are right there. If you got gallbladder problems, or if you have a bitter attitude, and so there's two columns. One is your feelings, and the other one is your organs. And if you got pain over here, try this remedy. It's not going to hurt you, and it might help, because what it does is it helps to relieve the stored memory of the trauma. Whether the trauma is disease or divorce or death or debt or disappointment, whatever it should be, it helps to take the out of it, and you go, right? And when you just relax the emotional memory in your body, your physical body starts to relax. And I know this sounds a little woo-woo or airy-fairy, but there are thousands and thousands of people who have benefited from these concepts. And once again, it won't harm you to give it a shot.
Absolutely. And there is an energetic component to this. You know, it's quantum physics. It's still newly being developed. You know, they used to do a lot of studies on cadavers. They were dead people. There wasn't that life force in there. You
Right,
know, now they're getting electron microscopes, cameras into the fascial system. And it's like this matrix of emotions and feelings. And I don't know enough about it, right? It's still cutting edge stuff that's happening. But I do know that I do get emotions trapped in my body. If I'm getting an injection in my broken leg of PRP, I cried last time. I
yeah,
literally just, they injected me and the pain of the accident came out. 11 years later,
yeah,
I can't quite explain it. And that's what I want to also look at helping people to. There's this missing piece because you could go get a chiropractic adjustment and it might hold, but then it's the thoughts you think. It's the way your lifestyle is. Are you in a really tough marriage? Are you looking, do you hate your job? You know, there's all these different layers that then
right,
get held on into the body repeatedly every day.
right, right. And sometimes the chiropractic adjustment relieves the tension and the pain because it was a mechanical problem that
Mhm.
was there, you know. But for others, you do the adjustments, it helps, but it comes back. It helps, but it comes back. It helps, but it comes. Those people need something more than just the mechanical approach.
Right.
And those people need the biochemical or the electromagnetic or the emotional or spiritual. And many, many times it's the emotional or spiritual. We think of it as a weakness if we have an emotional problem that's causing our problems. You know what? When uh, if if somebody said something that offends you, but you don't show it because you don't want to be emotional in front of them, but the emotions come up, you hold them in. Where do you hold them?
It's, yeah.
You have to hold them somewhere.
Mhm.
In your jaw, in your joints, in your back, in your heart, in your liver, your kidneys. The liver's about toxicity. You know, when you got liver problems, the world's a toxic world, and the heart one's getting heartbreak. But you have to hold them somewhere. And many times, those energies, those emotions, will stay with you. You know, Dr. Joe Dispenza is a remarkable teacher on the whole concept of this emotional or spiritual side of the pyramid of health. And how do you tap into that and empower yourself with whatever the condition is that you're working with? And he's demonstrated time and time again and has some really good science behind what he says. I mean, I like the guy. I just spent some time in one of his seminars, and I like him because he talks science, you know. And so to me, as a I like that kind of stuff. And so he said, "Oh, so it goes here, and then here, and then here." And I said, "Yeah, that's right, that's right. Oh, I didn't know that. Oh, that's right, that's right, that's right." So I follow his line of logic to where when you deal with the emotional, spiritual, I do believe if there's one category that's most powerful of all of them, it's this one. It's this one that we're talking about here today, and that is the emotional or spiritual side of the pyramid of health. And how do you address that? And most of us don't address it at all. We think it's a weakness in us if we recognize that there is an imbalance in that area, because we think we're all supposed to be perfect
Yes.
and we all are supposed to have it together. And, you know, uh, we walk the walk of having it together, but inside we're stumbling, right? And but we keep it to ourselves most of the time.
Absolutely, absolutely. And I love the fact that you are talking about this. This is a different side of Dr. Tom. So, have you had other experiences where you were working with someone and this emotional response came out? Yeah, if you're thinking
Oh,
way
okay.
back. Or I know, for example, I have worked with women, I do pelvic health, so I work internally and treat, and oftentimes there's so much birth trauma. A woman is planning to have the most beautiful delivery of their firstborn baby. They've got the doula, the midwife, everything, and then all of a sudden something goes wrong. And there's this initial trauma. And I treat a lot of back pain and pelvic pain and find that it's often related to that delivery and the trauma.
You bet. You bet. That's a very common tissue to hold unexperienced emotions, usually fear or trauma or um, being terrified. Very common that the pelvic basin will hold that. Um, but yeah, it happens quite regularly. Let's take a woman with diabetes who's doing the right food choices and is better, but not stable yet. And they appear to be doing everything correctly, but they're not stable. And so, you look them in the eye and you say, so where did you not have the sweetness of life?
Mm.
Because diabetes is all about sugar. It's all about sweetness. And when you ask the question, when someone is open and receptive and you ask the question, their eyes start getting puffy. And yeah, that one, what was that? And then when they start to talk about it, just the floodgates open up. Whether they're sobbing or not doesn't matter, but they're going back into that emotion and they're putting their toe in the water of that emotion. They're recognizing it. And that's when I say, that's a topic that you really want to look at with a professional, so that you can allow that to just run its course and not hold on to it, because it's affecting your diabetes. It's affecting your sweetness stability factors. We call that blood sugar stability. It's affecting that. So here's a couple of names of people who are really good at this kind of stuff, or you may have someone already to work with, but you need to work a little bit deeper than where you have so far. And then they come back, and in a couple of months, their diabetes is stable. Their blood sugar is stable, right? Their symptoms are greatly reduced.
Yeah, just sharing that awareness, just having the awareness with the support of you being an active listener.
I do believe that if people know what to do and it's presented in a way that's manageable and they don't have to change their entire lives, they're going to do it. To the best of their abilities, they're going to do it. And if they don't do it, then what's the roadblock? What's the emergency brake holding you back from making better food selections? What's the emergency brake? And what do I mean by emergency brake? If you ever back out of the driveway and you say, what's wrong with this car? It's moving, but it's so sluggish. Oh, the emergency brake. And you let go of the emergency brake. Now the car just goes back normally, right? That we have these emergency brakes in our lives that inhibit us from experiencing the life that we envision. Mm-hmm. And the more that we look at those and recognize those emergency brakes, because most of them are unconscious. We don't know about them, because if we did, we deal with them. The more that we address those, the happier we are and the healthier we are.
Mm-hmm. And I often see there's a correlation between maybe a health problem is present or an injury, but it just so happens you had a car accident, you got laid off, and you're divorcing your husband. It's this trifecta of all these experiences happening at once, and the body's like, talk about having a lot of parking emergency brakes on.
Right, exactly right. They seems to accumulate. That's the kind of thing where if you go to an astrologer, they go, whoa, whoa, what happened to you in 2001? Right? Well, what do you mean? I don't know. Nothing happened. No, something. What was it?
Oh, and you forget, God. You definitely forget.
Right. All right. Oh, my car accident was 2001 and I got divorced in 2002. And yeah, right.
It was that perfect storm. And I love it when I do an intake and they say, oh, but that was 25, 30 years ago. But it's still part of your body, and it's still, those scars really can stay. Emotional scars and physical scars are still there sometimes.
People go to their graves with their emotional scars if they don't have the tools to address them. Mm-hmm. They go to their graves with them. How do you know that? Well, just think about your aunts and uncles or your grandparents and how they act out sometimes. They're acting like children. That's their emotional stuff, right? And many of us, most of us do that to some degree or another. And it's on the areas that we have not yet addressed. We don't really know that that's affecting how we see the world. So you have an emotional scars like this. And everything you see in the world is through the emotional scars. So you're defensive around driving a car, and you're like this. And so you're tight on the wheel, which is very dangerous because you're not able to, your reflexes can't work very well when you're tight like this, right? But you see the whole world like this. And when you're able to just recognize and see this thing, and then just put it over here, because it's not going to go away. It never goes away. But it doesn't have to be here. That filters everything you see and think and feel. That it can be right here. It kind of goes along with you in life. Don't expect it to go away, but expect that it doesn't have to be the filter that you see your life through.
Absolutely. So it is shining awareness. And as we talk about, you have a great book, You Can Fix Your Brain. Love it. Love all the detailed information in there. Let's talk about the brain then, and how the external world or toxins are starting to impact our health as well. Because I
Oh
really
my
want to get your input on healing the trauma of disease. How can they, what steps can they take? Yes, show
goodness.
awareness to the emotions, but what else can we be doing with our
Well,
foods, with
let's
our environment?
right. Let's start with what can you do? And the subtitle of the book is very clear on that. The subtitle, so the title is You Can Fix Your Brain, and the subtitle is Just 1 hour a week to the best memory, productivity, and sleep you've ever had. And it's not a cutesy subtitle. It's the only formula for success that I know of. The only formula,
Mhm.
because we're so overwhelmed in our worlds today, and there's so much information and so much to do and no time to get it all done. You aren't going to change who you are at a basic operating level. That's not possible. But every Tuesday night after dinner, every Sunday morning after services, if you say, you know what, at this time every week, family, I'm allocating 1 hour to learn more of how we can all be healthier. So don't bother me. At Tuesday night at 7 o'clock, 7 to 8, my phone rings, you answer it, right? Whatever it should be, but you allocate 1 hour a week. And when you read the book and you learn that when you store leftover food in plastic storage containers, put in the refrigerator, the next day that chicken has got phthalates in it, which are chemicals used to mold plastic that affect your brain and affect your brain function. And you read that. Now you say, how can they get away with it? That can't be true. There's no evidence that the amount of phthalates that leach out of plastic storage containers overnight is toxic to humans. That's how they get away with that crap, because it's a minor amount. But this stuff is accumulative in your body over 20, 30, 40, 50 years, and it builds up and it builds up. And just go online and type in phthalates and Alzheimer's and look at the studies that say it's one of the contributors of many, but it's one of the contributors. So what's the 1 hour a week? Well, what's that about? So you on that Tuesday night, okay, I'm going back to the book, and Dr. Bryan had 3 URLs in there for glass storage containers. And so you go on the URL, mileskimball.com, and you look at those, and you go over to Amazon, you look, oh, I like those more. And you order 3 round ones and 2 square ones and 1 for the pies, and you pay with your credit card and you hit send, and you're done. It
Mhm.
took an hour. You're done for the week. But now never again will you poison your family with minute amounts of these toxic chemicals that accumulate in the brain and other tissues of your body. And every week you allocate 1 hour, 1 hour, and you learn one more thing, and you apply, you learn, how do I apply this in my life? And in 6 months, you've got this.
Mhm.
You've changed a number of habits. You're thinking differently. You're sleeping differently. You've got the right sleep equipment,
Yeah.
like pillows and blankets that don't have flame retardant chemicals in them that outgas all night, and you're breathing them. And you've gone through and you've taken a huge load off of your brain, so that the amount of inflammation in the brain that creates more stress hormones being produced is going down. And when the amount of stress hormones being produced goes down, you are a little more relaxed in day to day life. And when you're a little more relaxed in day to day life, your parasympathetic nervous system has a chance to operate more, which is the relaxation, healing, regenerating nervous system, as opposed to the sympathetic, the fight, flight, or fright. And when your parasympathetic nervous system is able to operate a little more in your life, you're more calm and your regenerative processes are better. Your skin looks different. You're regenerating healthier skin. Your adrenals are functioning better. Your thyroid's functioning better. You're rejuvenating a healthier body. And 6 months down the road, your friend sees you at church and says, I haven't seen you in a while. You look fabulous. What are you doing? Oh, I've just been applying some principles and slowly modifying how I live my life, and I feel a lot better. And that goes for the biochemistry, the electromagnetic, the emotional, spiritual, and the structural. 1 hour a week to all of these kinds of concepts, And in 6 months to a year, boom, you
Mm-hmm.
got it. That's the only way I know to do it and be successful, because all of our listeners, you're going to hear so many great interviews here, right? And oh, that's a good idea. I want to do that. Oh, that's a good idea. I want to do. Oh, that's a good idea. I want to do that. And you can't do it all. You can't, right? So you allocate an hour a week, and that's how you win the ball game of health.
Absolutely. Can you speak on the impact of stress even more? Because I think we get into autopilot, many of us, and the world is stressful with all the notifications on our phone, the telemarketers calling you're trying to figure out, the junk email, just stress at work, high demands, fast pace, go, go, go. I think
Yeah.
it really is hurting our brains and our behavior. It's really changing our behaviors.
Stress hormones are a primary contributor to brain degeneration.
Ooh.
Not in a day or a week, but over months and over years. Stress hormones cause what I call it B4, capital B number 4. And the scientists call it a breach of the blood-brain barrier. So when you produce stress hormones, uh, like adrenaline or other corticosteroids, other hormones that are stress hormones. You're driving your car and, oh my gosh, you've got to be there. You're going to be 2 minutes late and you're like rushing to get there. And when you're producing those hormones stay in your bloodstream for 5 hours. So what happens is that our ancestors only produced those hormones when something was needed to save their life. They're the fight, flight, or fright hormones. You have to fight saber-toothed tigers once in a while in life. You do. But it shouldn't be more than, let me tell you a little anatomy. The nerves of the sympathetic nervous system, the fight, flight, or fright nervous system, are really skinny. Let's say like my baby finger, much, much smaller, but like my baby finger. The nerves of the parasympathetic nervous system, the relaxation, regeneration nervous system, the size of my thumb, right, in comparison. So why are the sympathetic nerves faster or smaller? Any electrician will tell you the more insulation around a wire, the slower the conductivity of the wire to get to where it's going. So for your fight, flight, or fright, you have to respond instantaneously if there's a threat to save your life. And in our world today, we think of that as like hitting your brakes really quick if a kid runs out between two parked cars. You have to have that instantaneous response. But our ancestors, it was to save their life, right? And when you produce that hormone, your heart rate's going faster. There's more blood out to your muscles. There's no blood to digestion. That's not important to save your life. We need the blood to go out to where the priority system is, so you can run faster or be stronger to fight for your life. Your pupils are open really wide so you can see everything. Your brain is focused, intent, just laser sharp, just to save your life. The parasympathetic nervous system is more blood to digestion, good digestion, your muscles are relaxed, you're breathing deep, slow breaths, where the sympathetic is like that. Your brain is more open, daydreaming, able to visualize new projects, new futures. That's the parasympathetic nervous system, which is supposed to be in operation while you sleep. That's the only time you heal, is when you are in parasympathetic dominance, where the sympathetic nervous system is calmed down. There's not so much stress hormones. So can you imagine what happens when you watch the 11 o'clock news and then go to bed?
No.
Yeah, exactly. But
I'm bracing just thinking about it.
Most of the world does that, where they watch these terrible stories of what's happening in the world just before they want to go to sleep. Here's a good exercise to do. After dinner, take your pulse. Let's just see what your pulse is after dinner. And then take your pulse while you're watching the news. And notice that your heart rate's beating faster. That's sympathetic dominance. That's fight, flight, or fright. And we get kind of dulled to it and numb to it. So it doesn't take much. But if there's a story that really gets you, then you'll notice your heart rate goes up. Then you turn off the news and you go to bed. And you expect to be able to sleep deeply and activate your parasympathetic nervous system. You can't. The hormones are in your bloodstream for 5 hours from watching the news. And so you can't be in parasympathetic dominance. These are the people that sleep and don't feel refreshed when they wake up.
Mm-hmm.
There's too much stress hormones circulating in their bloodstream. They can't get into parasympathetic dominance, right? So what should you do in the evening? Don't watch the news. Watch a little comedy if you have to watch something. Watch something that makes you laugh. And then maybe take a hot bath. Just try it. Take a hot bath. Your muscles, maybe put a little Epsom salts in it so you get some extra magnesium. And magnesium helps you to sleep. Take a hot bath with Epsom salts and then just notice if you wake up in the morning, well, I feel pretty good this morning. That's what you want to do more of the time, is to take care of this machine that's carrying us through life that for 30 years or 40 years or 50 years or 60 years has been accustomed to watching the news and going to bed with a heart rate that's going boom, 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 boom. And I'm exaggerating a little bit, to be dramatic, but that's what happens in our bodies. Once again, if you remember, you only heal and you regenerate when you're in parasympathetic dominance. That's just a fact of physiology. And what's regeneration? What am I talking about? Every cell in your body regenerates. You have an entire new body every 7 years. Every cell regenerates. You get a new cell. And some cells are very quick, like the inside of your guts every 2 to 3 days. Some cells are very slow, like bone cells and brain cells, but every cell regenerates. So what are you regenerating? Are you regenerating a healthier cell or regenerating a same cell that's not working so well or regenerating a weaker cell? That's all determined by how you live your life, what kind of cells you regenerate. So when you do the 1 hour a week thing and just try a new thing every week for 1 hour, just learn a little more and then say, all right, I'll take a look at that one and apply it. Once again, in 6 months or a year, you have a different body. You've been healing and regenerating every night, just a little bit. And, every time I sign a book, when someone asks me at one of my talks or something, it's always the same. I sign base hits win the ball game because everybody wants a home run.
Yep.
And that's what the pharmaceutical companies want you to believe. Take this and you get a home run. Well, no, you don't. You get all these side effects that'll kill you. And we forget to listen to the voice in the background when the happy people are playing volleyball, and the girls that are bouncing and the guys that are hunks and Adonis, they're all out there happy and laughing. But the voiceover says, warning, this product may kill you, right? But we don't pay attention to that because we want the nice stuff in there, the nice stuff of life.
And I think so many people are just pushing through their day. Let me get more done. Let me go. That's also increasing muscle tension, putting you in that sympathetic. And really the healing does begin when you can be more in the parasympathetic.
As you say that, I could hear a lot of people saying, I don't have a choice. Because so many people are pushing through their day and their mind is, I don't have a choice. And you're right, you don't. You've set your life up right now, so you don't have a choice. You've got to push through your day just to get it all done, whether it's taking care of the kids and the spouse or, going to work, whatever. You don't have a choice. But 1 hour a week, you do have a choice about that. 1 hour a week to learn a little bit and apply a little base hit. And in 6 months, you've got a different perspective. You've got a different life. You've got a different body. That's the only way I know, Phaedra, for us to be successful in turning the course. Because if you're concerned about your health and your health is going down, how do you stop a boulder that's going downhill? It's going downhill. You want to get in the way of that? What you have to do is taper it and then just guide it up. That takes a year, 2 years to do. Oh my God, I can't have my pain for another year. Well, how long have you had it? 17 years. Well, if it's going to take 6 months, are you willing, if it makes sense to you? Stop expecting home runs and be willing to let this thing run its course as best as you can at 1 hour a week. And what people normally find is that they start to turn it around pretty darn quickly. In 3 or 4 weeks, oh, I'm sleeping better. I wake up a little more refreshed. I only hit the snooze once instead of 7 times,
Mhm.
right, in the morning. So,
Yeah, it's really good to track that and really pay attention, because sometimes even if I take, say, a Bach flower essence, it works, but I forget that it worked and I just go on my day. It's not
right,
really having the awareness. Do you know what I mean? Or I do homeopathy and I have to check and put an alarm on my phone an hour later. Did the GABA supplement I take help me? Because we
right,
just take it for granted and we got to keep going.
right. My wife has been working with essential oils now for a couple of years, and I love it. She just put some oil on my neck. I say, "Oh, that smells nice. I guess whatever." I'm not an oil guy myself, and I noticed a little while later, I just feel a little different. It's nice. It's soft and easy, but it seems to help. So whatever the tools are you're going to use, base hits win the ball game. You
Mhm.
don't have to suffer. You do not have to suffer. You can fix your brain. That's why I put the title of the book as kind of a basic, dumbed down title. You can fix your brain. I mean, it's that simple. You can fix your brain. And I thought, we went through about 2 weeks of possible titles and some really great ones, optimum healing for brain health and all that kind of thing. But you can fix your brain 1 hour a week to the best memory, productivity, and sleep you've ever had. And it's got over 350 studies in there. And I just talk the science in everyday language as best as I can so that people can say, oh, well, that just makes sense. Okay, I can try that. For example, nail polish. I talked about plastic containers, nail polish. You put nail polish on, and the toxic chemicals in the nail polish are in your bloodstream in 3 to 5 minutes. And well, there's no evidence that the amount of chemicals that leach out of nail polish into your bloodstream in 3 to 5 minutes is toxic to humans. That's how they get away with this. But this stuff is accumulative. And then you look at the studies about these chemicals, the phthalates, and neurogenesis, which is new nerve growth or new brain cell growth. And you see these chemicals inhibit new brain cell growth. That's why when you look at, there's a study that came out, 346 pregnant women, they checked their urine in the 8th month of pregnancy. This was in Chicago. And they categorized the results into fourths, the lowest fourth, the next fourth, the third fourth, and the highest fourth. And then they followed the offspring of these pregnancies. And when these children turned 7 years old, they did Wechsler IQ tests on them. That's the official IQ test. Every child whose mother was in the highest amount of phthalates in pregnancy in their urine compared to the mothers in the lowest phthalate level in urine, every child in the highest level, their IQ was 7 points lower than the children in the lowest phthalate level. 7 points. That doesn't mean anything to anybody until you realize that 1 point difference is noticeable. 7 points difference is the difference between a child working really hard, getting straight A's, and a child working really hard, getting straight C's. They don't have the brain power, the wiring, the neural network, because mom was high in phthalates during pregnancy. Mom didn't know this stuff had just been accumulating for 25 years. And mom, because she had high levels of phthalates, neurogenesis was inhibited for baby's growth in utero. You read the studies and you go, what? So every woman who is hearing this needs to go online or get my book and look at the URLs for cosmetic companies that are organic and phthalate free. And you take 1 hour a week and you just go online, you order a couple of different nail polishes, and they comes, you say, well, I don't like that one. And say, oh, I like that one. That's what you use.
Mhm.
And throw the other junk out. Don't use it up because you're poisoning yourself, right? And
Mhm.
it's those little baby steps that just help you. And of course, our brain power determines our outlook on life. So when you have a brain that's less inflamed, working better, your outlook on life changes, which gives you more of a sense of inner peace and inner strength, which empowers you to deal with some of the hidden emotions that were buried from years past that are still inside, because you're pretty stable now. You feel pretty good. Oh, yeah, I can look at, oh, man, that was terrible when that happened. That was just terrible that happened to me. And you can take this and just put it over here and then go on with life.
Yep. Sometimes it's hard, though. I see with my clients, it really lingers. It lingers, and that's that
Right.
toxicity piece too.
Yeah, exactly right. There's four sides, and often you have to deal with two or three or four of the sides to get the results that you want.
Okay. And what are the early warning signs that your brain might be needing some work, that you're
Oh,
going down the road to brain disease?
that's really a great question.
Because anxiety is probably pretty common these days. I know a lot of people report that. Could that even be a basic symptom?
Oh, sure, sure. Yeah, anxiety, depression, schizophrenia, bipolar disorder. But those are really common. It means your brain hormones called neurotransmitters are not quite balanced right. There's something out of balance there. But so those are certainly signs, or brain fog, or walking into a room and forgetting why you walked in the room, or where did I put my keys, or where did I park in the parking lot? What parking lot am I in at the shopping center? All of those are signs. But there's a really good sign that has 17 studies that identifies it as an early marker of preclinical Alzheimer's. 17 studies. Now, one elder in three dies with dementia. That's the statistic today. So this is really important for people to know. And there's only one set of nerves in the body that go up into the brain with no screening, no filters, no interference. And I've talked to a number of neurologists. They all agree, yeah, that's true. I said, you know why? They said, no, I don't know. Well, here's why. So what are the nerves? The nerves of smell. The nerves of smell go right back into the brain without any screening. Why? Because they go back to the area of the brain called the hippocampus, the memory center, which is where Alzheimer's is, in the hippocampus. Why? Well, because our ancestors, if they found something, you see, you have the same body as your ancestor 3,000 years ago.
Mhm.
You have the same kidneys, they work the same reproductive tract, the same elbows, the same bones and muscles, the same brain. We use our brains more, but we have the same kind of function from our brains. And back then, ancestor walking along on the trails, they grab something, they smell it to see if it's safe to eat before they taste it for taste buds. That's the purpose of taste buds. One of the purposes is spit it out if it's poison for you. But smell was the first line of defense. Also, if you're walking down the trail and you smell saber-toothed tiger, you better turn around really quick. So the human sense of smell is more sophisticated than a dog's. But we don't know that because we don't use it anymore. And we have more nerve fibers than they do. But dogs smell a lot, and they can recognize people by the smell and all that. Humans can't usually, because we've not worked with and developed our sense of smell. But the hardware's there. All the hardware is there. So when you start to lose your sense of smell, it's not a problem of the nose. It's a problem of the memory center in the brain. And there are many, many studies on this. Matter of fact, I'm going to get something. I just have to walk around the side here while I grab something out of my suitcase that I didn't think I was going to talk about with you, but this is too cool not to talk about. So let me just pull this out now. So when I read about this concept, I called the author of the study, Dr. Richard Doty at the University of Pennsylvania. That is the go-to center in the English language, so I think in the world, for researching the importance of the sense of smell. And they have many, many research papers published, and he's written 2 books on this. And I said, is this true? He said, yes, because here's the statistic. If you are over the age of 45 and you're losing your sense of smell, you have a 68% increased risk of mortality within 5 years of something. 68% higher risk compared to someone not losing their sense of smell. That's like, what? Mortality from what? From anything. Heart disease, dementia, cancer, something. So you read these studies and it just drops your jaw. So I called Dr. Doty and we put together the smell identification test.
Oh, wow.
And so what you do is you scratch here like on a lottery ticket. You scratch it and then you smell it. And is it tomato, menthol, strawberry, or licorice? And you just mark it right here with what it is. Then you turn the page. And the next one, you scratch it and you smell it. Is it cherry, honey, lime, or whiskey? And you mark it in the yellow box. And you turn the page. And you do this 12 times. And at the end, you filled in the answer sheet. Here's the answers. And if you score 10 or above, great, you're doing great. Don't worry about it. Check it again in a year.
Wow.
If you score 9 or less, you have hyposmia, which means a loss of losing the sense of smell, reduced sense of smell. So I put this on my website. It's thedr.com/smell. And I gave you 5 studies there. And you can download the studies, take them to your doctor, read them yourself if you like. One is for the general public from Scientific American. The others are more geeky studies, but they're right there. They're free. And you can order the smell test there, and you do the smell test. And if it comes back and it's not where you'd want it to be, go to your doctor and say, Doc, I just did the smell test and, I scored 7. And you say, oh, don't worry about it, it's nothing. Well, wait a minute. Here's the studies. Here's 5 studies on this. Can you read these studies and tell me if this makes sense or not? And if they say, no, it's a bunch of hogwash, they just don't have the time because there are many, many studies on this. But I put a couple of videos in there. Listen to this video before you do the test. Listen to this video after you've done the test, right? And so I give you some guidelines on how to find a practitioner that can help you. But you want to identify if your brain's not firing on all 8 cylinders. And I'm from Detroit originally, so I talk car talk, right? But, if you want to know, this is the test. And if this comes back positive, then there are much more sophisticated tests to do with your doctor to see where's the problem at, what's going on, which then gives you the window of opportunity to do something about it, to stop the loss, to stop the inflammation that's going on in the hippocampus area of your brain. That's where all this is going, is that it's a biomarker that you can identify early that, wait a minute, so I have inflammation in the brain killing off brain cells? Yes. Is this permanent? No. Stop throwing gasoline on the fire and the inflammation goes down. Mm-hmm. Well, what does that mean? I don't know. You have to find out. Is it food sensitivities? Is it phthalate accumulation? Is it glyphosates from GMO? Is it heavy metals that have accumulated in your brain like aluminum or mercury? Just go to Google and type in aluminum and Alzheimer's, and you see so many studies on this, right? Aluminum chlorhydrate that we put under our arms, and if you're cooking with aluminum pots or you're drinking out of aluminum cans, you'll learn all this in the book. You can fix your brain. But this is a biomarker to say, time for you to put a little attention on this right now.
Mm-hmm. Is that related to the cranial nerves then, testing smell? Is there something, what inhibits the smelling that makes you smell less? Or maybe there's a difference between a right nostril and a left nostril.
The message of what you're smelling is going back in the nerves, back up to your brain, but the brain cells are being killed off. There's been inflammation in there. You have hippocampal atrophy.
Oh,
that's the technical term for it. It means your brain's shrinking because cells are being killed off one cell at a time, one cell at a time, one cell at a time. Why? Because of the inflammation. Now, here's where we tie it back to stress hormones and the stress, because the stress hormones create B4, a breach of the blood-brain barrier, leaky brain. You've heard of leaky gut, you get leaky brain. Mm-hmm. And when you get leaky brain, you get more brain inflammation. So if you're getting brain inflammation in the hippocampal area of the brain, you're losing your memory. Oh, I'm not remembering the way I used to. I must be getting old. Haha. How old are you? 38. No, that's not supposed to happen. That's
Right.
not supposed to happen, right? But we're also nervous about it, and we don't know what to do, that we kind of joke about it, giggling a little bit, because we don't know what to do, because your doctors don't know what to do. Now you'll know what to do. Now you'll know that there's a path. You can fix your brain. That's what that book is all about.
Beautiful, beautiful. And last question I have, what have you studied about cell phones? Because they're almost everything a necessity now. And how are they harming our brains? The dopamine, that fast, oh, this is a hit, this is a hit, this is something pleasant, this is something pleasant. Addiction almost.
I just talked about this last night. Um, 1978, it was my first week in my medical education.
Mm.
Do absolutely nothing. And I saw a sign in the hall at school that Dr. Sheldon Deal, Mr. Arizona, was going to be talking this weekend. Oh, cool. The guy's a bodybuilder, Mr. Arizona. I'll go see what he's about. Must be a healthy guy. He had a color TV in the room. And he turned the color TV on, but turned the volume off. So it was just the picture. Walked over to a desk, opened his briefcase, took out a bar magnet the size of a cell phone, held it up, walked up to the color TV. The picture went upside down. Walked away, it went right side up. Walked towards it, it went upside down. Walked away, it went right side up. And he said, that's what electromagnetic pollution does to your body, your brain, and your nervous system. And at that time, he was talking about batteries and watches and the electromagnetic leakage from a battery on your arm. And it's called neurological switching. I learned that before I knew anything about neurology. And what does that mean? You say right when you mean left. You write letters like you write receive, R-E-C-E-I-V. Oh, wait, it's the other way around. That you do things in reverse sometimes. That's switching. And that happens because our nervous system is being assaulted by something that's throwing it out of balance. That's electromagnetics. Now, it's much, much worse now than it ever has been in history. No humans have ever had to deal with this before. What we have to deal with now, the 3G and the 4G and now the 5G. I've got so many patients, they come in, a pediatrician had irregular heartbeats at 48 years old. Nothing fixed it. So she had to have a pacemaker put in. And one day her husband was at home doing something and a plumber came over and they were talking and says, yeah, my wife, she's a pediatrician, but she's got a pacemaker at 48, regular heartbeats. And the guy said, well, my wife had irregular heartbeats and it was the smart meter. And we took the smart meter out and her heart calmed down right away. The guy went, what? Told his wife. She did a little research and found out that there was science to this. They took the smart meter out and her heart stabilized right away within a week, I think it was. Right? So the electromagnetic pollution that we're being exposed to has never occurred before in history. We have no defense as human beings. Our immune system can't do anything about it at all. And just look at the incidence of, just type in Google, is there a rise in brain tumors? And you see there's a tremendous rise at much younger ages than ever before because they're holding a battery next to their brain. Right next to their brain, especially kids, because kids have thinner skulls. So the radiation from a cell phone penetrates deeper into the brain because there's less bone to kind of filter it out of there. Everyone needs to be using a corded headset, not a Bluetooth.
That's another thing. That's all the rage.
That's a battery on your ear. What, do you think it's any different? Right? Yeah. So everyone needs to get accustomed to learning to work with a corded headset. They're much better. They're not perfect, but they're much better. And don't put, you see cases all the time of women with breast cancer and they kept their phone in the pocket where they got cancer. I mean, you just see it every once in a while. So you bet this whole world of 5G is nasty. It's nasty. 1981, I think it was the first study I saw that children living within a quarter mile of high-powered tension wires had a much higher incidence of leukemia. I think it was like 26% or something like that. And that was back in 1981. Now we know it's so much worse because What 5G does, it puts a cell tower every few houses on the street. So you don't need to be a quarter mile within a quarter mile of a high power tension wire now, because your neighbor's got the 5G thing transmitter on their house or on the pole outside their house. So your entire family's being bathed with this. I think a new tool in the tool chest, I just said this last week for the first time. Everybody's got a tool chest in their house, with a screwdriver, a couple of different types of screwdrivers, and a hammer, maybe a wrench or a couple other things. You also need an EMF meter. You need to be able to measure in your house how much electromagnetic leakage is in the house. How much electromagnetic leakage is there from this color television? How much electromagnetic leakage is there from this boom box because it's Bluetooth, so it's emitting? How much electromagnetic leakage from the coffee machine if it's got a remote control? And you'll see that, and some meters 0 to 3 is okay, some 0 to 10, depends on the meter. And you'll see 1, 1, 1.4, 1, 1, 9. What? 9? Yeah, the dimmer switch on the wall is leaking electromagnetic energy at 3 times what's safe for you. But when you bring the thing away from it 2 or 3 feet away, it's dissipated. So what does that mean? Well, at least don't stand next to the dimmer switch on your wall, right? But some of them, they permeate through the room, and some you'll see what's outside on the telephone pole, the radiation's coming into the house. So an EMF meter, and they're on my website, or you can go to Google and type it in. There are many different EMF meters out there. But it's a new tool in the tool chest, because electromagnetic pollution is one of the sides to the pyramid of health now. Never before in history has it been that major a player. It is now. Cancer, brain degenerations, attention deficit, autism, autoimmune diseases. You'll see the studies if you just Google. You'll see the studies on this.
What about all those smart gadgets for your home now to get your AC to work automatically, to set your alarm, everything? I think just you're getting bombarded with Bluetooth.
It's so convenient. It's so convenient to have all those, but they all emit electromagnetic pollution. So in the immortal words of Rosanna Dana, you think? Once again, our immune system has no protection from electromagnetic pollution. Our ancestors never had that. We haven't genetically developed resistance to this. Mm-hmm. So we're just like sponges taking this in, and it's just damaging our chromosomes and damaging our DNA and causing mutated cells to develop. Every cell regenerates, but you're starting to regenerate mutated cells because of this electromagnetic pollution damaging your DNA.
And often people aren't taking a look at this until there's really a problem.
Until somebody in the family is diagnosed with an aggressive cancer.
We have Ryan Sternagle. I think you know him. His son was diagnosed with cancer just before 1 year old. And he is totally committed with his wife, Teddy, and they built a home in the middle of the woods away from Wi-Fi, and he's doing really great now. But they're going to be talking about how they modified their home too. It's real.
Ryan's a good friend, and he did the deep dive in this, as I've done the deep dive into wheat and autoimmune diseases and talking about how those mechanisms of taxing our immune system come into play. Ryan has done the deep dive into cancer and triggers to cancer.
Yeah.
Yes.
It's real.
Yes, it's very real. It's very, very real.
Well, Dr. Tom, I enjoyed this conversation today. You've been with me through all my series, so thank you. Do you have any final words? I love the heart and the emotion you put into today's interview.
Oh, thank you so much. It's really always a pleasure to be with you. And, if there's anything that I would say as a final word, it's that base hits win the ball game. And be kind to yourself in this process. It won't take long, and you will get to the home run. You will achieve the goal of a healthier, more vital you.
Beautiful. When you just said that, it just got me more parasympathetic, more relaxed, than thinking, oh, I have to do it all at once. That's
Yes,
sympathetic. So.
right.
Well, thank you so much for all the work that you do, Dr. Tom, in the world, and for the continued research and presenting to us to help us towards better health. Thank you.
Thank you so much.
That was such a great interview. Thank you so much, Dr. Tom O'Brien. You know, really in just an hour a week, watching summits like this, interview series, taking notes, and implementing just one little thing perhaps a week, within a year, you can grow so much. So I appreciate that insight from Dr. Tom, and he talks about it at great length in his Fix Your Brain book. So I hope you found value in this interview today, and I'm happy to be guiding you on this journey. So stay tuned. We have many more amazing interviews coming up. And if you love this series and you'd like to own it, consider purchasing an all access pass. You'll get lots of bonuses with it, including a one-on-one session with me. So we can talk about all that stuff that you might be holding on to, all those challenges that you're facing. And maybe, just maybe, after you get off the video call, you just might feel a little lighter. That will be my intention. So stay tuned. We have many more amazing interviews to share with you.